Well, good evening, everyone. My name is Brad Bergstrom, and I'm lucky enough to be the superintendent here for Sauk Rapids Rice Public Schools. And welcome to the Wednesday, April 14th storm forecast. I'm happy that you are here to join us tonight. The purpose of these Facebook Live sessions, for those of you that might be new, are really to try and answer some questions that people might have. We've got people here that are monitoring the chat sessions or the chat box to write those questions down. So starting now, you can, if you have questions and you got something on your mind, please go ahead and start putting them in, and they're being monitored, and they'll get those questions to me, and I'll try to answer them if I possibly can. A couple other housekeeping items is just a reminder, I'm not always able to answer all the questions that come my way, and for those that I cannot, we'll try to get that information out to everybody for the next session when we meet. And for a while now, we've been doing these every other week, and so it might be a couple weeks before you get an answer. But I sometimes will take this information and also put it into my weekly communication that goes out to parents, guardians, and families. So greatly appreciate you taking the time to put the questions in. And again, if I can't answer it, we'll try to get that information out, or get the answer to that, get the information out as soon as we possibly can. The purpose, again, is to try and answer questions, and just a reminder to treat each other nicely through this process. You might not always agree with what I have to say or a question that somebody might ask, but we're just going to ask that everybody treats each other respectfully as we go through this next approximately hour of time to try and answer the questions that you have. So I think that's it with the housekeeping items. And as I'm waiting for questions to come, I've got a couple of topics that I want to talk about, and the first one that I want to talk about with everybody is in the COVID testing and students. So back a few weeks ago, the state of Minnesota began a program of encouraging families to have their children tested. And in the last couple of weeks, they have put into play with this that if a family wants to get test results or go get tests, the saliva test for COVID testing, they can bring that into the school, and we can send in the results when we do the ones from the school district as well. So let me explain a little bit more what that means. So every couple of weeks, in fact, it's this Thursday coming up tomorrow, that there's an opportunity for all the staff at Sauk Rapids Rice Public Schools to take a COVID test. Then in the afternoon, we wind up bringing those to get shipped, and generally we get the results back the next day, sometimes later in the afternoon, but most of the time within 24 hours, we get a result back in terms of where we're at with the test results. And what the state of Minnesota is encouraging is that if a family wants to order a COVID test, and there's a multitude of ways in which you can do that, you can take the test. A student can take the test, and then you can bring it to us here at the school on those Thursdays, and we'll go ahead and we'll send that shipment in with the ones that we have, and then you can get the results back within 24 hours. At least that's what it's been as of late. That's an opportunity. Now, there's been a couple of maybe things that haven't been as clear, and I want to make sure that everybody understands. Number one, this is not a requirement for students and families. It is not a requirement for our students who are currently in distance learning family choice to be able to come in and do our MCA testing, which we're going to be working on here over the coming weeks. It is simply an option for families if they should so choose to want to have their child tested. And so again, this is not a requirement of the school. We are simply the messengers and simply the people that will collect that. We do want to have those test results brought in on that Thursday. We don't want to have them sitting around here for a period of days because it's a collection issue for us. But certainly can bring them in on that Thursday and get them to the school nurse, and we'll go ahead and we'll add that in with or the school health in the school health office, we'll certainly get those put in with us and shipped out. Now, one of the key questions that we just got an answer to here a few hours ago was, how long ahead of time can you do this? So in other words, the testing piece is generally you can pick them up, get them 8 to 8 on a Thursday. Well, it's pretty hard sometimes to be able to do that test on Thursday morning or Thursday during the school day, etc. So what we have learned is that you can certainly take the test a couple of days ahead of time. You can do it Tuesday or Wednesday, and it will still be a valid test. The way that it works, you take your saliva and you spit it into the tube. You put a cap on it. It's got a dye in it, and that dye will actually preserve the specimen, the saliva specimen, for a period of days. And so at the end, ultimately, you can take the test on Tuesday or Wednesday at home if you'd like, and then on Thursday morning, bring it to school, give it to the school health office, and they can go ahead and they can send that in with the rest of the tubes that are going in, or the tests that are going in with the staff here from the district. So just wanted to make sure that we clarified that it's not a requirement. It is an option. We will be more than happy to collect those saliva tests on the day of and get them sent in, and so you can get those results back. And again, it's not a requirement for those who are in distance learning to come in for MCA testing. It's not a requirement for students to come to school every day. Not every family, it's a requirement for every family to do this. It's if you should so choose. And the state is recommending that this happen, that testing happening every 2 weeks. They're across the state, we are seeing increases in COVID cases. We're in particularly seeing increases in children. One of the variants that's out there is more easily spread amongst children, something we didn't see back in the fall and in the winter. So getting tested from the state's perspective is something that they'd like to see families do. But again, I'm going to come back to the idea that it is not a requirement. When do we do these tests? We'll do one tomorrow, and we'll have a pickup day tomorrow. We'll do it on April 30th, April 29th, May 13th, and May 27th. So again, if you would like to have your child do a COVID saliva test, you can order it. You can't order it from us. You can't come pick one up here. You've got to do that on your own. By the way, there is they do ask for insurance information, but at the end of the day, you're not being charged for this. The insurance company isn't being charged for this, so you don't have to worry about paying for that or insurance company being charged. That's being picked up by the state. The company that they're utilizing for this is Vault. And so at the end of the day, it is something that, again, will be here to help support the collection of it on that day of, and then move it forward from there so you can get your results. If you have any other questions, make sure that you go ahead and reach out to the school, and we'll try to answer them for you. I've got some questions here, so I'm going to see what we have. Okay. Okay, so we're going to just a clarifying piece. Not back to the insurance question that component that I brought up. Not having insurance is not a barrier. It is free for everybody. So please, if you feel comfortable and want to do that, please have your child tested, and we can be that collection site starting tomorrow, and we'll do it again on the 29th of April, and then in May we're going to do it on the 13th and then the 27th. The question is do students have to come in for the MCAs? And the answer to that is, it's two parts. One is that, yes, if you're going to take the MCA test, the state of Minnesota, because of testing protocols, etc., it is a requirement that you have to come in to do that. And ultimately, if a family chooses they don't want their child to come to school to take the MCAs, it's not a requirement. On a bit of a tangent here, the state of Minnesota is still offering the test is still saying schools need to have students take the test, but the results from that are not going to be a part of the state's reporting to the federal government. There's a waiver for that for this year. However, we are required to offer the test, and to take the test, you have to do it in person. We cannot do that virtually because of testing protocols. The next question here is, if I send a test, have my child do a saliva test and bring it to the school, and it gets sent in with the staff testing tubes that go in, who's the results going to go to? The results will go to the family. They do not come to us at the school. We are simply just the carrier of those tubes, those tests, to get them to the vault testing facility so that they can be processed. Even our staff here in the district, when they take the saliva test, the school does not get that information. It goes directly to the person. When I take my saliva test every 2 weeks, the results do not come to anybody in HR. They don't come to the school. They come to my personal email. So rest assured that if you use the school as the vehicle to get the test result, or to get the sample test down to vault, we do not get the results from that. So a great clarifying question. I appreciate that. This next question is, what percentage of the saliva tests come back positive? I don't know what they are here because we don't get the results. We don't have any idea. What I do know is that in talking to some of our healthcare professionals in the community, listening to what the Department of Health is saying, in our region, last week, the positivity rate was over 10%. And that number has been creeping up over time. Back in February, middle to latter part of February, things were, when our COVID cases were much lower, that positivity rate was less than 4%. Anything less than 5% is good. You start creeping over 5%, there starts to be some concern. Again, you get to 10% and beyond, that's troublesome. When things were at their peak for us, across the state, and including in this region here, we had positivity rates of over 25%. So again, I don't know what they are for the test results that are coming through the school district. Excuse me, but last week we did learn that the positivity rate for our region is over 10%. How much of staff have completed the vaccine process is the next question. And the answer to that is, excuse me, is simply, I don't know. And how can you say I don't know, Superintendent Bergstrom? They're the staff that work in the building. With the decision to take the vaccine or not is a very personal one. And we did not require that our staff report back to us if they chose to take the vaccine or not. We worked very diligently with our partners at Benton County Public Health, at CentraCare, and others to line up opportunities for our staff to get the vaccine if they so chose to do that. But we do not have the percentage, as it's not a requirement. That's a very personal decision. We do know that staff have chosen to take it. I'm very public with the fact that I got the vaccine. I did the Moderna one and had my 2 shots and those pieces. But unless somebody comes and tells us, we don't know. But because again, it's a very personal choice. We do know in Benton County that we are one of the lowest counties in the state in terms of percentage of people who are eligible for the vaccine that have actually gotten the vaccine. That's not a correlation or a thought process about where we're at the school. It's just simply a fact, and that's something that we want to encourage people, if they so choose to, there's the opportunity for the vaccine, and to go ahead and get signed up for that. But as a school district, it's not a requirement. It's not something that we're requiring our staff to tell us. The next question here is, can parents choose distance learning still if they want? And the answer to that question is yes, but. Up until probably just before the start of the third trimester, it was pretty much if parents wanted, they could go at any time, and that's still the case. In particularly if there's a health reason for that. If there's a health risk that has presented itself, absolutely, families can go in there. Let me rephrase that. Parents can choose the option to go to distance learning. Okay. However, if it's not a health-related reason, we're trying to limit that simply because it's a different teacher, a different process, and it takes a while to transition, and that process is another loss of instructional time. For most families, if they come and they talk to us and explain what's going on, the right decision will be made. But I want to be very clear, it's just not, well, today I want to do this and then tomorrow I want to go back. Nope. We're trying to for staffing purposes, we're really trying hard to be consistent. Now, as numbers continue to increase, as if there's a family that has a health risk and they really want to make a change, again, reach out to your child's building level administrator and talk about that. And if it's the right move and the right decision, we certainly will entertain that opening. The next question is with COVID rising amongst kids, is there any talk of going remote again? And it's actually, thank you, whoever asked this question, it's actually one of the key points that I want to talk about here is that over the last several weeks, I have been getting phone calls and communication with a persistent rumor that the school is going to be going into either hybrid learning or going to remote learning. And the first time I heard about it was, well, the rumor was that when we come back from our Easter break, our spring break, is that, yep, Sauk Rapids Rice is going to be going into remote learning or hybrid learning. I heard it again last week. I've heard it again this week. And I want to be really clear with this. Are numbers going up? Yes, they are. Are they to the same low spot to where they were last fall when we finally had to make the move to remote learning? No, and particularly with our staff. We do worry about the numbers that are where our students are at, which will lead into another conversation that I want to have, and that is just this re-emphasis on the importance of the mitigation strategies that we have in place, and why, even though things have been going pretty well I think we're in week 11, completing week 11 of being in person at the secondary level, week 13 at the elementary level. And while that's been going very well, we cannot let our guard down, and the importance of those mitigation strategies are exceptionally important. So is there a chance? Yes, there is. Is there talk about it? We talk about just about every day, where are the numbers at? How are things going? At each and every board meeting, there's an update to the board members to help them to understand where it's at. But again, it's something that we're looking at all the time. I'll never say never with COVID. But at the end of the day, it is not, there hasn't been any talk of, oh, tomorrow we have to do this or next week we got to do this. And again, we continue to watch the numbers. We continue to talk with the people in public health and others to see where we're at. Am I concerned? Yes, I am concerned because the numbers are starting to creep up. Are we at a point to say we got to make a move? Not yet. But again, things could in a week from now could look very different, both in a positive way but also in a negative way. So we constantly monitor to see where that's at. And at the end of the day, if there's going to be movement, the board will act upon that, and then that communication will go out to our families. This next question is can a parent opt out of the MCA testing for their student? And the answer to that question is yes. Certainly can. My concern, or let me give you my superintendent perspective with that, okay? So first of all, let's talk about what's the purpose of the MCA tests. A lot of people believe that the purpose for the MCA tests is to see how smart kids are, and that couldn't be farther from the truth. The purpose of the MCA tests is to really find out how we are doing as a district with the teaching of the state standards. And it can be a tool for us to figure out what we're doing well and maybe some things that we may need to make some improvement in. But it is not an assessment. It is not a test on how smart kids are. We have, unfortunately, in my humble estimation, utilized the MCA test for a purpose that it's never been intended for. It is not intended to say how smart kids are. It is, can it be a byproduct? Sure, it possibly could be, but it's really for us. And so for me as a superintendent, I want to know how we're doing with our kids. I want to know, are we meeting the needs of our kids? And then if we're not, who are those kids and what do we need to do differently in order to help meet those needs? So yes, can a parent opt out? You can, you bet. There's a process you go through for that. I'm encouraging us to take the tests so that we know how we're doing. Does it give parents feedback? Absolutely it does. It tells you what their learning has been in the state standards for the state of Minnesota. Absolutely. But I want to be really clear that it's not a test of somebody's, how smart they are. Okay? Smart is not who you are, it's what you become. And in order to help us to get there, we need to monitor and see how we're doing. As you can probably tell, I've got a bit of a passion with this, but at the end of the day, please know as a parent that the choice is yours. I'm hoping that parents will say, we want to know how our child is doing, and we also want to know, that give the school the opportunity to see how they're doing. And sometimes we're doing very well, and sometimes we've got areas that we need to work on. So again, to the answer to the question is yes, but I'm hoping that people will choose to take the test, so it'll help us have a better understanding of how we're doing and what, if any, changes we need to make. So the next question is if saliva testing is done as part of recommendations, will clinics see kids for regular appointments even if they're negative? In the past, this was an issue. I don't know the answer to that question, but we do have a weekly meeting here in the district, have been doing it since this summer. We call it our COVID Incident Management Team. And as a part of that, we do have partners with Public Health as well as Centricare, and I will ask this question to our partners at Centricare, and I'll come back to that next time we meet, which is going to be on the 29th, and I'll try to have that question answered for you. So great question, I just don't know the answer to that right now. This next question is, aren't kids placed in classes based upon their MCAs? Not that I'm aware of, and not a strategy that I think would be a sole strategy for placing kids into classes. There's a number of factors that go into placing of students, and in particularly I'm talking about at the elementary level. When you get into the secondary level, it's more about classes that you may choose to take, and that kind of decides where you're going to be at. More so at the high school than at the middle school level. But no, might MCAs play a factor with that? Sure, they might. If we have students who are demonstrating some skills that they're lacking in, or that they are exceeding in, there might be some grouping based upon that, but it is not a factor in kids being. It's not the factor that in terms of kids being placed in classes. Is it a part of it? Yes, but is it a sole factor? No, absolutely, it's not. There's a lot of different factors that go into doing that. My understanding of placing students in classes, and particularly at the elementary level. I should also add to this piece, there are times when we have students who are showing persistent lack of success in certain areas. As you get to the secondary level, there might be some remediation courses or some support classes that students might be placed into to help with that. But again, it is not the factor in determining where things are at. Otherwise, if we didn't have MCAs, how would we place kids? So again, it is a part of it, but it is not the sole factor in placing students into classes. So the next question I have here is, with the numbers creeping up, how could this affect seniors and graduation and prom? And that's a great question, and it's another one of the topics that I have here. And I'm from a superintendent's perspective, I really think it's important when it comes to prom and to graduation that the high school administrative team and their leadership team have a voice in what this process is going to look like, and that communication needs to come from them. So how might it, so I'm not going to be here tonight to say, yes, there is prom, no, there is graduation, any of those things. We are still planning for them. There's been nothing to say that we're not going to. Are they going to look the same? No, not compared to what we saw pre-March of 2020. Is it going to look different than what we saw last year? Could be, could be. A lot of this will be dependent upon how things are going in our schools, in our community, and in our region. And I've been asked a couple of different times in regards to this prom and graduation, how come you're not saying anything right now? Okay, so we do know that prom, for example, is scheduled for May 15th. We do know that graduation is scheduled for Tuesday, June 1st. It was on the calendar. The prom date was changed, but the graduation date has stayed the same. And the one thing that we have learned about COVID is that things change. And so the reason why more specific details have not come out sooner is that the minute that you say it's going to be this or this, and then if COVID causes things to change, now you've created a bunch of situations you just don't want to have. So will there be information coming out? Yes. In fact, I talked with the principal at the high school earlier this week, and he has said that information will be coming out this week to families. It may not have all of the exact details, but there is going to be information coming out at the beginning or sometime this week. So be looking for that. Could COVID impact that? Absolutely it could. We do have direction and expectations from the Department of Health and the Department of Education in terms of what can and should be done, and we will follow those. But we do know that when we surveyed the seniors at the high school, the two most important things to them about prom were Grand March and a dance. And so we want to acknowledge that for them and try to have that happen. Is it going to be a dance like we've seen prior to COVID coming? No, it won't be. They talk about dancing can happen in groups of 6, and you have to stay potted up and those things. And so it's going to look different, but where our hope is that we're going to be able to have something. And I say our hope, it's what our plan might be, but it's all going to be dependent upon what happens with COVID in our community. And if COVID rates get too high and we can't do it, then we can't. And that's why it's so important that we continue to follow those mitigation strategies that we have been utilizing since the beginning of the year. And have we adjusted some of them along the way? Yes, we have. But things like face coverings, things like social distancing to the extent possible, things like the hygiene, having good hygiene, they are more important now than ever, because despite the fact that numbers are not where they were last October, end of October, November, December, they are still capable of increasing if we don't stay diligent. Now, I know and understand that when a family, let me rephrase that. When I say I know, that means I've experienced it, and I haven't. My children are grown, they're married, and so I can't say that I know that, but I can understand for a family when it comes to COVID and the contact tracing and the close contact piece. It is something that can make life very uncomfortable. It can wreck plans. It creates issues for families that are unfortunate indeed. But if we don't hold to those principles of face coverings, social distancing to the extent possible, and the good hygiene, we are going to have a greater risk of things like staying in person, things like having some sort of a prom, things like having some sort of a graduation. It puts those things in jeopardy. I'm not saying it's not going to happen, and I'm not trying to say that this is an ultimatum for everybody, but what I am trying to say is that the importance of continuing those strategies is critical for us. And COVID waits for us to let our guard down, and when we do, it just steps in and numbers come up, and then we have to back away from what we are planning and wanting to do, which again leads back to why there hasn't been more specific details up to this point, because we don't want to get out too far ahead of the curve and then have to turn around and do something different. So again, it is a very tough piece for us as a school district, as your school superintendent, to keep these mitigation strategies in place. We get phone calls from parents who are unhappy because of the close contact piece, and we get phone calls from people from why do we have to wear face coverings? I get it, understand it, but it's for our kids, and it's the way in which we've been able to be in person longer than most people in the region have been able to do. And for that, I'm not apologetic for, but I just want people to understand why it's so important that we stay where we're at with these mitigation strategies. And it's not easy. I get that. It's not easy to stand here and say this either. But it is critically important for us so that we can have some sort of what we've been doing up to this point and offering other opportunities for as long as we possibly can. So I appreciate the question, and I appreciate your diligence and your understanding and letting me go off on a bit of a tangent. But it really is about trying to make sure that it's the safety of our staff and students, it's a consistency of a learning model, and it's the opportunity to offer things, albeit different than pre-March of 2020, something that we couldn't do a year ago. A year ago, we sat here and we said there is no prom. A year ago, we said we don't even know if we're going to be able to have a graduation. And now we can do those things, but we just have to make sure that we're doing all the little things right and not letting COVID come in and have an impact on those things that we want to do. Okay, thank you for your time with that question. A couple other things here as I'll wait for more questions to come. Just a gentle reminder for our families that we have an early release on this coming Friday, and we'll have 2 more of those on April 30th and then also on May 14th. So we've got 3 more, and there'll be early releases following the same schedule as we've had with the first 2, but just a gentle reminder for our families that we are scheduled for another early release to happen this coming Friday. And I see there's a question here. So the question is, so do we have to give the COVID test to the nurse, or do we mail them close to the time? Ideally, we would be bringing them, having them be brought in on the day of the test, the day that we collect. That's what we're looking for. What I don't want to see happen is somebody either mail it and it gets to us too late, and then after a certain amount of time, the COVID test is going to be invalid. And number 2, then it also causes us to have to store them, and we're just not prepared for that, and probably should not be doing that. So again, the mailing piece is a little bit of an issue, and I'm not sure that would be the recommended way. It certainly would be to have it be brought to the school, and we can work on getting that collected and put in with the rest of the samples. So we prefer that it be brought to the school and given to the health office so that we can go ahead and get that sample put in there. Say that.
Putting the spit tube in the backpack.
Yes. Sorry, I had to ask a clarifying question there. Thank you, Christy. This is a great point. So when the specimen comes to the school, if you put it in the backpack, please know that you're not just taking that tube and shoving it into the backpack. There's a bag and there's some other pieces that go with that. So just know, don't take it and just shove it in the backpack, but rather, again, use the bag that is provided for that, and we'll get it here. So the traveling for that should be just fine in a backpack as long as you follow the process and the procedure. Again, you're not just taking that tube and putting it into the backpack. So some gentle reminders as I wait for more questions here. I'm looking at the time here. Oh, time flies when you're having fun. So just some key reminders for everybody. And I know that there's a lot of people that are not listening in on these sessions. And I'm appreciative for those of you that are out there right now listening to this. Thank you for taking time out of your evening to do that. And so if you can help spread the word with this, it'd be greatly appreciated. So just some key reminders. Number 1 is that when our school nurses, who do a vast majority of the calling, or our administrators, when they call to let you know as a parent or a guardian that your child has been in close contact, please remember that they are the messenger. There's nobody in the district that's going around and saying, well, I think it's this student and I think it's that student, or you know what, today I want to do this. It's the task of contact tracing is really about talking to the people that are impacted, taking their word for what's being said, and then moving forward from there. So remember, they are the messenger. I understand that it now creates another burden for families. And that can't be easy, but they're the messenger. And so please remember that they're just doing their job, and they're not the ones that are trying to do this on purpose. Okay. Second thing is that if you have anybody at home that is staying at home pending the result of a COVID test, it is important that everybody in the family needs to stay home. Again, it gets back to some of those mitigation strategies that we're doing. I understand it's not ideal. I totally get it. And this is becoming more of an issue for families as our student numbers increase. And I know this is not easy, but if we're having students if we have a student at home and other students go to school, when they test positive, if they test positive, it winds up having an impact on those students, and then there's contact tracing, and it just spirals out. I wish I could take the picture that was shown to me of just how fast a virus like this can spread if we're not being cautious with our mitigation strategies. So again, if you have someone at home, including a parent, who is waiting for test results, please do not send the other members of the household to school until we get those results, until you get that negative test result, and then we can be good to go from there. And let us know in the attendance office what you have going on. That's a really key part to this, is the communication strategies. Number 2 reminder, we are still continuing to follow the 14-day guidance. And again, I'll come back to why the 14 days. CDC, Department of Health, Benton County Public Health, they all will say that it is the safest and the best strategy when it comes to quarantining. If you go less than that, it's extremely important that we maintain at least 6 feet of social distancing until you get to day 14. Now, the longer you go, is it less likely that you're going to test positive? That is true, but it doesn't mean that you won't. And so if you're on day 13 and you test positive and we're not social distancing, now we've just taken another group of staff and students and they now have to quarantine. So I know that there are some that say it's 7 days, it's 10 days. That's correct. We are staying with 14 to keep everybody safe and to make sure that we're not allowing the virus to spread as a result of coming back too early. So just wanted to make sure that I shared that. I see I got a couple of questions. So a couple of things here, I want to make sure that I clarify. I'm going to turn to Christy just to make sure I'm answering the question right here. Okay, so when I talk about if somebody is at home pending a test, it's only for those if you're symptomatic. So if you're part of every 2 weeks you decide you're going to go through and have your child or you're going to do the testing, you don't have to stay home unless you got symptoms. And so if in my household, it was myself and my wife and our 2 daughters were still at home and we were testing, as long as people are not symptomatic, everybody goes to work, everybody goes to school, everybody's good. But if I wind up getting symptoms and I go get tested, until I get the results back in terms of, say, a negative test, everybody in the household has to stay put. Okay? And that is a fundamentally important piece. And to the question, and for Christy for raising this point, I think that's a really valid point, because the testing piece can get a little bit convoluted now, because you can test every 2 weeks and again, and turn in the sample and we'll get that sent in. When I talk about staying at home pending test results, it's only if you're symptomatic. Okay? So if you're not symptomatic, keep right on going. So for example, if tomorrow I'll do my saliva test, I don't have to stay home pending the results. But if I get 1 or more of those major symptoms or 2 or more of the minor symptoms, then I'm symptomatic and I got to stay home till I get the results. Or go to a medical provider and get a diagnosis saying that it's not COVID, and you're good to go as well. Because we do know that some of the symptoms of COVID are the same things that you might see with allergies, etc. Okay? And as we go into the spring, although it snowed here, so the pollen piece probably isn't going to be as bad. But at some point, we're going to see that stuff go away, right? And so we might see more of that. And we saw the same thing in the fall, that we saw an uptick in allergies and those things. And it is difficult. But again, because the symptoms present the same, we need to test and make sure. And you can either get that through a medical provider or pending the result of your test. So if you're not symptomatic and you are testing, you don't have to stay at home. If you are symptomatic and you're pending your results, you and anybody in your household needs to stay at home until that negative test comes back. One of the major questions that I get in terms of the contact tracing is, what is that? What is close contact? What does that mean? So when we're doing contact tracing, the criteria that we use is 6 feet or less for 15 minutes or more in a given day. Back a number of months ago, we actually had students and adults who thought that it was no more than 15 minutes, take a break, and you can come back for another 15 minutes. They actually would take out their phone and they would set a timer, and at 14 minutes they get up, go walk away, and then turn around a few minutes later and come back. Nope, it's throughout the course of the day. Now, I've also had people ask me, well, they say that in school that you need to be 3 feet. We social distance to the extent possible, and yes, it is. We try for the 3 feet to make that happen. But when it comes to the contact tracing, it is 6 feet. Because again, we don't want to have people who are in close contact and then they turn around and they test positive, and they could be asymptomatic, which means that they have the virus, but they're not presenting any symptoms, and then now they're spreading it to others. So at the end of the day, that 6 feet is for the contact tracing is a very important piece. And it's based on conversations, it's based on seating charts. It's not an exact science. But our staff do an amazing job in a short period of time of making those determinations, and they're doing the very best job that they can with it. And that's why when that call comes, remember, we're the messengers, and we're just trying to make sure that everybody is staying safe. The next one that I want to talk about here is that if you get a phone call from the school, please try as best you can to return that phone call in a timely manner. What we don't want to have happening is potential students who are that are symptomatic or have been in close contact, and now we're putting more kids together because we can't put them back in the classroom. We don't have a parent or guardian to come pick them up, so that means we have to house them somewhere in the building, and we don't want to be mixing kids across pods, those kinds of things. So if you get that phone call, again, I'm sorry that you're getting it, but if you can return that call in a timely manner, that would be very helpful. We understand that for some families, some jobs, some positions, it's not easy to do that, but we seem to be seeing much more of that, and I get it and I understand it that it's probably it's not the call that you want to get, but your help with that would be greatly appreciated. And ultimately, why again are these things so important? Because we are seeing numbers increase in our region, across the state. The variant, I forget the number B117 or something like that, and I might be wrong with that, but that variant is showing up in about 50 to 60% of the across the state of the positive tests, and it's one that spreads rather much easier than what we saw last fall. And so again, maintaining the safety of our staff and our students, maintaining consistency in our learning model, and also maintaining the potential opportunity to offer things such as our activities, a prom, a graduation, as close to we possibly can as normal. This is part of the reason why we need to make sure that we're doing that. And at the end of the day, I want to make sure that our staff and our students are safe. I don't want the result of us not being diligent about our communication and our strategies, and then somebody winds up getting sick and has some long-term health effects as a result of this. That is something it's just not acceptable to me. So again, at the end of the day, these are the reasons why we're doing what we're doing. I'm looking around here and I'm not seeing any more questions. Just want to say thank you for joining me tonight. I really do appreciate it. Hopefully this has been helpful for you. Hopefully I haven't added any more confusion for people. I do appreciate the questions that are being asked. Just a couple of other things, reminders. We're still looking for subs, and if you've got a 4-year degree and you'd be interested in substitute teaching for us, we'd love to have you. Reach out to our HR office, and we'd love to get that taken care of and get you joining us. We are also looking for subs in other positions as well. And because of that, if you're interested in coming to sub for us, we'd love to have that conversation with you. We know that without you, it's going to be difficult. We know that we go as the community goes, and we also know that we have experienced 11 and 13 weeks of in-person, and at a time when most people didn't think we were going to be able to do that. So, and that's because of the work of everybody. It's our community, it's our parents, it's our staff, and it's people following the expectations. It's the face coverings, it's the good hygiene, it's the social distancing to the extent possible. These are all critically important pieces for us. So with that, I want to thank you for your time. I will look to find out where the clinics are at. I've got the question here, and we'll do that in our next storm forecast, which right now it will be scheduled for Wednesday, April 29th. And with that, I'm going to go ahead and sign off. Have a great evening. Thanks for being here. Take care and go storm. Good night.